Once a casualty's heart has stopped, the only definitive way to restart it is through the use of a defibrillator. Apologies, I've jumped a page. Okay, once the ambulance has been called, the first aider can continue to help the casualty by carrying out cardiopulmonary resuscitation, or CPR. Contrary to popular belief, CPR is unlikely to cause the casualty to suddenly recover. However, it does help to keep the body oxygenated and therefore significantly increases their chances of survival. CPR is carried out by combining 30 chest compressions with 2 rescue breaths, commonly known as mouth-to-mouth. For rescuers who are concerned about the cleanliness of performing mouth-to-mouth resuscitation, a compression-only technique can be used. However, this is not as effective. In this case, the first aider has an emergency face shield with them, and which will provide sufficient protection. In order to be effective, CPR should be carried out continuously until advanced help takes over. This can be very tiring, and therefore if 2 or more rescuers are present, they should swap every 2 minutes. Once a casualty's heart has stopped, the only definitive way to restart it is through the use of a defibrillator, a machine which provides a controlled electrical shock to the heart. This must be done quickly, and the chances of survival decrease by 10 to 15% for every minute the defibrillation is delayed. With this in mind, there are several initiatives to try to ensure that a defibrillator reaches the patient as quickly as possible. This includes public access defibrillators, which are placed in prominent locations such as stations, airports and shopping centres, and also the use of community first responder schemes. These schemes involve the ambulance service sending trained volunteers to 999 calls in certain locations to render advanced first aid. For example, defibrillation, prior to the arrival of an emergency ambulance. When the community first responder arrives, they can apply an automatic external defibrillator, or AED, to the patient. As the name suggests, the AED works to automatically analyse the casualty's heart rhythm and determine whether a shock is